will show them to you on the next slide. But my part in this is that I'm, as a researcher, is part of a national competence center that supports these projects that have received funding from the European Social Fund to work with social innovation, and we support them with knowledge and methods and community and exchange of experience and so forth. And we do that, or I do that as part of Forum for Social Innovation. So I'm part of this as a researcher, but there are also a lot of other persons involved from the Forum for Social Innovation. And we do this on behalf of the Swedish ESF Council. So we're not doing this on our own initiative, but we actually have the national public authority backing us in doing this. So here you can see all the funded projects so far. There are 12. I won't describe all of them to you, but I wanted to just describe a few so you get a feeling for what kind of projects are funded in the social innovation area of the European Social Fund in Sweden. So for example, we have DC farming. They use the surplus energy from data centers to warm up what to say, växthus. Greenhouse, thank you. They use the surplus energy to warm up greenhouses, and the greenhouse is used for work integration purposes, and they will have the ambition to start a social enterprise at the long term. So that's both an ecological and a social gain is their ambition. And we also have this föreningsliv och folkhälsa i praktiken. That's what would you say, the civil society and public health in practice. That's a municipality that is managing that project together with the civil society. And they have been funding in this second call about innovative work integration measures. And then we can take a third one that is called Stärkta förutsättningar för unga med IF. In English it's strengthened preconditions for young people with intellectual disabilities. And that's a public region in Gothenburg in Sweden that helps then people with intellectual disabilities get closer to the labor markets. So that's, of course, this is a lot about the labor market, but it's also about health, social health, and also about social inclusion in these projects, because that's the main focus of the European Social Fund. So, as part of the Competence Center, we support these projects then. You can see that at the bottom of this slide that we support them with coaching, coalition meetings, cluster evaluations and that's of course focused on their social innovation processes in supporting them. But as we all know, a project cannot sort of doesn't have the full control over the sort of preconditions at the program level. So we also support the European Social Fund Council to sort of design their call processes. We have reflection meetings and learning sessions with them in order also to further develop the program for social innovation, so that the projects that will be financed or are already being financed can have good preconditions for managing their projects, and first and foremost to sort of make their solutions survive after the project has ended, to make these lasting and value-creating solutions. And we also support the system level, also the ecosystem for social innovation, by focusing on scaling, financing, national and regional support structures, and so forth. So we work on all these three levels. And actually, I don't work on these three levels as a researcher, but we have really good process facilitators and experts doing that. But as a researcher, I'm part of that little bubble to the top left here, analysis and learning. So my role and my colleagues as researchers who are also participating, we do an annual analysis report where we analyze how can we support social innovation through these 3 levels. So we sort of bring all the lessons and insights from these 3 levels into an aggregated analysis. And we arrange an annual conference when we also, or we are part of arranging an annual conference as researchers. Of course, everyone is part of that in all these levels and in our little bubble too here. But there we also share the experiences from this analysis and discuss that together with stakeholders. We have reference groups, and we are also planning on doing some research publications about this. And we have done some conference presentations and so forth. So just to show you what we support, what kind of knowledge and method that we help support these projects with, and also at the program level and system level. So here is an example of a model that is based on a lot of research on social innovation internationally, that sort of delineates the different elements of developing and supporting social innovation. So you should see this as a sort of moving frame, that you're constantly moving between these different elements. And of course, it's about understanding the societal challenge that you can see to the left there, to really analyze what is the cause and effects of this problem that we are trying to address. But it's also about envisioning societal change. It's not only about understanding a problem, but about sort of seeing the future. What do we want? What kind of society do we want to contribute to? So that's also an important part of social innovation, to support with different methods and knowledge and so forth. And of course, to mobilize actors and resources is an important part, to see what kinds of actors in different societal sectors that are relevant and even necessary to involve in order to change something in this addressed area. And the development and tests is also an important part of social innovation, and to do that in a way that involves the people, of course, and different kinds of people, we should say, and different kinds of actors in this process. And then the most challenging part can be to realize and disseminate and scale the tested solutions, because maybe your project funding stops after development and test. That's often the case, and also in the European Social Fund, that you get funding for testing an idea, but not for sort of making that last in society. So it's really often a challenge after ending the project to make this sustainable. And in social innovation, that can be especially tricky, because it's not clear who should sort of finance this, or who should manage this in the long term run. And then, of course, it's about creating value for individuals, organizations, and society. So then you do this spin. So in each of these elements, there is, of course, a lot of knowledge and methods that we try to support the projects in. And first and foremost, we try to support them to see this whole map. Because often when they are in their social innovation processes, they are so engaged in their own phase, or in their own sort of part where they are standing. So but in order to see how is this really going to make a change, we support them in seeing the whole picture. So this is one of the models that we use. We use some other models too, and they're all research-based. So we really want to work in that way. And of course, me as a researcher is a proponent of that approach. And this is actually my last slide, because, as I said, we do this aggregated analysis as researchers in the Competence Center. So here you see the first annual report that was launched last year. It's unfortunately only available in Swedish, so I guess that most of you don't understand at all what this is saying, but the main title is a support structure for innovative inclusion in working life and society. And you can download it to the right, and you can also read more about the Competence Center there. But I just checked now before this seminar, I saw that there is no English translation. As well, I will ask the Forum for Social Innovation to provide such a translation for you to read in the future, at least. So I think I will stop there. I guess I haven't used up all my minutes, Maria, but that's a good start, I hope.
Yes, you had around 2 minutes left.
Okay, that's good. You were just about to do your 2 minutes sign. Yeah.
Thank you so much, Malin. Very interesting to hear about this competence center and the work you do within it. I hand over to you, Per.
Yes, thank you very much, Maria. And as Malin said, it's a pleasure to present to you today. I will see if I can manage to get this to full screen. So as Maria mentioned, I have a background in medicine. I moved a bit more towards public health and towards health promotion. And my PhD studies focuses on a mentor-mother program that has been implemented in Sweden, and that was originally developed in South Africa. So I will briefly describe this program, how it was developed in South Africa, how it has been implemented in Sweden, and the research that I've been conducting in relation to this. So first off, the Mentor Mother program was initiated by an organization called Pilani Maternal Child Health and Nutrition Trust. And it was initiated in 2006. Pilani had for a long time, since the end of the 1970s, been working with maternal and child health in townships in Cape Town, predominantly. And they realized that they had to have more of a community-based approach towards these questions. The previous approach had been largely focused on nutritional clinics, but the most vulnerable families did not reach those clinics. So Pilani developed a mentor mother program, which builds on the idea that challenges within a community can be solved by building on strengths within that same community. So Pilani recruits women who have managed to raise healthy children despite challenging circumstances to work as mentor mothers. And this is called the positive peer deviance model. That is that within a certain group, there are some individuals who use exceptional strategies to manage difficult circumstances, and that those people can use those strategies to support other people through the same process. And it builds then on peer support. That is that mothers who have, or women who have experiences of social disadvantage and motherhood can support other women who are going through motherhood. Pilani employs these mentor mothers, and they receive 6 weeks of training in maternal and child health and related subjects. And they provide support for women in the area where they live through home visits, where they educate client mothers on maternal and child health and parenting, but they also refer clients to clinics or to social services and such when needed. And they summarized the approach through this quote: "We aim to improve health outcomes by combining our skills and resources with the knowledge and resources that exist in the community." They currently employ around 260 mentor mothers, conducting about 30,000 home visits monthly. The majority of these mentor mothers work in Cape Town, in peri-urban townships, which you can see on the image to the right. And a minority of these mentor mothers also work in Eastern Cape, in more rural areas. The Mentor Mother program has been extensively evaluated through a series of trials. I will not go into detail into those studies, but the program has been shown to contribute to lower rates of stunting. That is when a child does not grow as expected. Low rates of vertical HIV transmission, that is mother-to-child HIV transmission. Higher antenatal care attendance, lower rates of hospitalization among children, better vocabularies among children. The Mentor Mother program has been previously contextualized to Ethiopia, Egypt, and Eswatini. Eswatini then is formerly known as Swaziland. In Eswatini, the Mentor Mother program is implemented by SIHI, which is an organization, and you can see an image from SIHI on the right. In 2018, an initiative was taken to contextualize the program to socially disadvantaged communities in Sweden. This initiative was taken by the Church of Sweden, who had been following and supporting Pilani's work in South Africa for many years. And the initiative was also taken in collaboration then with Uppsala University. Of course, new contexts means new focus areas, even if the approach to community outreach is somewhat similar. So the Swedish setting then. In Sweden, we have a universalist health and welfare system, and the conditions of early life constitute a public health priority. But despite this universalist health and welfare system, inequities in health remain. Partly this can be explained by social differences in social determinants of health, such as income, education, and so on. But it can also be explained by differences in service use. And service use then entails things such as preventive health services offered through the primary care, through maternity care, or through child health services. It can include services such as vaccinations, where we, for example, during the pandemic, could see quite large differences in vaccination rates between different areas and different social groups in Sweden. One very stark effect of this is that the infant mortality rate is twice as high among children born to mothers who have migrated from outside of Europe to Sweden as compared to the population at large. And in order to understand differences in service use, Brandenberger et al. Has published a very nice review, I think, that has summarized barriers to service use among disadvantaged groups in high-income countries as challenges related to continuity of care, as related to communication, and that can include, for example, language difficulties or a lack of access to interpreters, but also differences in confidence, which includes trust in institutions and trust in the health system and the welfare system. And an example of how trust is linked to public health can be found, for example, within the vaccination program, where lack of trust in vaccinations, of course, leads to lower vaccination rates. In Sweden, the Mentor Mother program has been implemented in Gothenburg city, which is found in the southwest. And it's implemented by an organization called Tidigt Föräldrastöd, which translates to early parental support. Tidigt föräldrastöd have been running a community doula service for many years, where women who themselves are mothers and who have migrated to Sweden from outside of Europe support other pregnant women during pregnancy and during birth. And they have continual discussions with them on topics relating to maternal and child health and what to expect during birth. And there's also a psychosocial component of that, of providing a sense of safety during birth. And the Mentor Mother program was implemented as an extension of this community doula service, where after birth, the mentor mothers continue to follow their clients up to 5 years after birth. It has also been implemented in a somewhat different form in Malmö city, in the far south in Sweden, where it's implemented by the social enterprise Jallatrappan. Jallatrappan has been working with women who have migrated to Sweden for many years, and their main focus has been on inclusion on the labor market. And the focus of the program implemented by Jallatrappan has mainly been on facilitating contacts between socially vulnerable mothers and different actors and services within the welfare system at large. And here then we have the mentor mothers working for tidigt föräldrastöd and some of the women working for Jallatrappan. Both the mentor mothers or peer supporters that they are called in Malmö and the target group are then they both share the experience of migrating to Sweden. And through the program, they address community needs in the form of both social determinants of health, but also relating to, for example, mistrust of authorities in the welfare system, including the health services that are freely available in Sweden. And the intervention is provided partly through individual support, which has an educational component where client mothers receive information on maternal and child health, children's rights, the organization of the welfare system, and the rights and obligations of parents in Sweden, and social expectations of children and parents in Sweden. There's also a practical component where mothers can receive practical help, and where the mentor mothers and peer supporters can support the clients, for example, during appointments with authorities or with health services. There is a psychosocial component and a motivational component as well. And in the program implemented in Malmö, there's also a part of the program that focuses on group courses that are held in cooperation with local maternal and child health services, social services, and other actors. For example, dental clinics and other local authorities. And during these group courses, women or mothers who share the same language receive a course, and mentor mothers participate during that course as well and can act as interpreters if needed. We have two qualitative studies that has been published on the program in Malmö. One study that focused on the process of adapting the innovation to the local context in Malmö. and another mainly qualitative study that has focused on the process of implementing this program. And I would like to say something about the study focused on the implementation process. So we looked partly on contextual factors that acted as barriers or enablers during this process. And what emerged in the interviews that we held with peer supporters, their clients, and other actors on a more organizational level was that mistrust in social services was a barrier to implementation, because the peer supporters shared some characteristics with the social workers, and they had somewhat similar tasks in their work. And mistrust in the social services also led to somewhat of a skepticism towards the peer supporters. Also, unpredictable funding and gender norms, which led the women to struggle with engaging in activities outside of the home, emerged as barriers. And a facilitator in the process was the organization's third sector affiliation, that is, that they belong to the civil society, which enabled them to act as somewhat of a mediator between the clients that is supported and the public system, that is the health system and welfare system, or actors within that system. During implementation, we saw that they had a high adherence to the tasks that focused on facilitating contacts with other services. That is, for example, the peer supporters could join client mothers to meetings with, for example, healthcare providers. And that part of the intervention was quite easy to implement. But they had an inconsistent adherence to educational tasks, where some peer supporters struggled a bit with delivering educational components of the intervention. And an explanation given for that was that they saw themselves as competing with other experts, that is, for example, healthcare providers, when they discussed topics of relating to maternal and child health. We also saw that they found it difficult to conduct home visits, because the home was saw as a bit too much of a private sphere for them to feel comfortable. And they also felt that they could not assume that the clients that they supported saw the home as a safe sphere or a safe platform. And within relating to mechanisms of impact, what emerged in the interviews was that initial practical support enabled trustful relationships, which in turn then enabled more comprehensive psychosocial support, which could entail, for example, discussing topics such as domestic violence and such. That was difficult to engage in early on. We also found that peer supporters experienced somewhat blurred personal and professional roles, where their own identity as mothers who had overcome social disadvantage was a very key component of their work. One unintended effect of this blurred line between personal and professional roles was that client mothers often had contact with the peer supporters outside of office hours. So, with that said, we currently have a grant application that we have submitted, where we hope to evaluate the program in Gothenburg through a set of scales relating to mental health, parental sense of competence, sense of coherence, and trust in health and welfare services. And I would like to conclude this by showing you this picture, which I borrowed from Mulgan and Polford, and the report called Study on Social Innovation, where they say that in order for successful scaling of social innovation to take place, we need pull factors, that is effective demand, where there's a demand for certain types of services. We need push factors in the form of effective supply, that is that we have an effective intervention. We need effective strategies that connect push and pull factors, that is organizational forms or entities that can put the innovation in place. And very importantly, we need continual learning and adaptation. With that said, I think I will finish my presentation here.
Thank you so much, Pat. And I now give the word to Art.
Thanks, Maria, and thank you very much, Malin and Per, for the insightful talk. Malin, for your affirmation of the approaches we take at SIHI, particularly, and the presentation of the iterative framework of the social innovation process to contextualize our activities were incredibly valuable. The concept of the competence center support resonated with me deeply, which actually sparked some thoughts on how we in the Philippines might integrate such ideas into our approach towards funding research for a more tangible social impact, especially now that in the coming months we're gonna submit another proposal to the Department of Science and Technology to run the social innovation call and probably take a look at on how we can probably recalibrate some of our strategies for supporting those winning innovations. Per, for sharing your social innovation, your work on social innovation in action and the demonstration of how robust research can provide the necessary evidence of its effectiveness. It's really underscored the critical role of social innovation as a strategy in addressing health equity. So I'm now opening the virtual floor for any questions or comments to our speakers. So anyone from our participants in the call would like to ask some questions, just raise your virtual hands if you like, or unmute yourself. But I'm gonna check the chat box if there are any other comments or questions. So from Dr. Meredith Labarda, thank you, Malin. You presented many interesting things on social innovation. She's also impressed on the Competence Center and its support for social innovations. And again from Dr. Meredith, interesting work view for Per with Pilani. We had the privilege of visiting them in Cape Town last November. Impressive mentor models. Okay, I'm not seeing any hands raised, but I would like to ask. Well, for Malin, I would like to know more about the process of developing these frameworks, and especially the steps taken or the conversations that started, that initiated that work in building that competence center support process. Could you tell me more about that so that for those interested, hubs or us in the Philippines, for that matter, would be perhaps replicating that in the future? What advice sort of would you like to give us?
Yeah, and I think it's maybe also be some similar starting points for you and us, because it was both top down and bottom up. The Forum for Social Innovation had existed since 2010, so it had existed for over 10 years already when the European Social Fund decided to initiate this type of support function. So the Forum for Social Innovation could then sort of just further develop their existing activities to further support social innovation, and then particularly in the European Social Fund. So that was sort of a combination of the top down and the bottom up. So kind of grasping the opportunity, but of course this policy opportunity was quite unique, I guess, so that the European Union decided to promote. They have promoted social innovation through the European social funds for a long period of time, but not, they have sort of stepped up their efforts more and more. So that was good. But I think that another part of this is that I didn't mention in my presentation is that for social innovation is established at a university in Sweden. It's established at Malmö University where I work, but it's also in cooperation, of course, with other societal actors. So you have to form this, because a university on its own cannot sort of, of course, you have a lot of competence, but it cannot alone, I believe, gather all the knowledge and the methods and the support that is needed to help projects in this European Social Fund to realize their idea. I think that we have to sort of gather knowledge and examples from different areas of society. So that's important too in this part.
Yeah, thanks for sharing that, Malin. I think that process in itself is social innovation, because it circles back to your very definition of, social innovation as building new relationships and ensuring collaborations to make things happen, right? So yeah, thanks for those tips. Per, I understand. What do you think are the initial or some of your general ideas in terms of communicating social innovation in research to some specific stakeholders, say policymakers, to really adopt such a process and probably support more funds for social innovation? Because as you can see, you get into the details of its rigor, etc. But of course, some of our decision makers are not really keen into understanding those details. So what do you think are the elements that will help us communicate adequately social innovation projects to policymakers?
Yeah, thank you. That's a great question. Within our project, we have had some communication with local authorities. So, for example, the organization that is working in Western Sweden, Tidigt Föräldrastöd, who has this mentor mother program, they have tried to set up what we can call a public-private partnership with local authorities. And we have tried to be involved in that process by communicating our research to those authorities that are responsible for initiating public-private partnerships. So we have tried to find ways of taking the research that we have produced and communicated in a digestible way, which has been a little bit of a challenge when you are used to communicating to an academic audience, and you realize you have to kind of adapt your messages. I think what is very important on a longer term is to find ways of undertaking outcome evaluations of these types of projects, because having hard evidence for that the program that you're studying actually has some type of measurable outcome, I think that can really enable like securing funding through local authorities. So we have been struggling a bit to find good outcome measures for the Mentor Mother program in Sweden. I showed you some of the measures that we have planned to use. For example, parental sense of competence, which is measured through a validated scale, or trust in authorities and the health system, which is also measured through a validated scale. But these are all process indicators and we've struggled a bit to find really good outcome indicators. But I think that if we were to find good indicators and measure those in a way that can display the effects of this intervention, I think that could really contribute to securing funding. Yeah.
Thanks, Per. Certainly, those indicators are important, that especially those indicators that resonate with those that holds the funds and those that develops policies. And yeah, so thank you very much again, Per and Malin. Jacqueline, is this a comment or like a question? But I would just like to read it. But feel free again to raise your hand if you have if you'd like to verbalize it to our resource speakers. So the EU LAC program always includes innovation as an approach. However, this is more addressed as technological innovation. How can we make an impact to also include social innovation, and especially social innovation in health, as a very important approach to LAC? Maybe a comment from Malin and Per on this regard.
Yeah, and I guess that most of you share this perception of when policy support to innovation is discussed, it's most often discussed in technological terms. And I believe that the discussions of social innovation and the support to social innovation comes from other sources, often the more socially focused parts of policy. So that means that the innovation area largely remains restricted to technological innovation, and a lot of resources are channeled to that part of the innovation spectrum. So that's my personal sort of engagement as a researcher is to broaden that view of innovation, to show that innovation cannot only be studied or understood or promoted in terms of technology. It always has to be the social parts of technology, but also the social development besides technology.
Thank you, Malin. Any other comment, Per?
Yeah, I think initiatives such as Social Innovation in Health Initiative, of course, contribute to how we collectively conceptualize innovation. But of course, that is a long process.
And I also think it's quite special that mentor mom or mentor mothers actually have had such a academic support, that you have studied them, both the dissemination or the adaptation in African countries, and also the then dissemination and adaptation to Sweden. And that's really a privilege, I would say.
Absolutely. It's been a privilege. I've been when I write my papers, for example, or present at conferences, I've been very keen or very careful to present it as a social innovation, I can also say. I think there are many similar initiatives in Sweden and elsewhere that might not use that terminology. But presenting it as a social innovation, I believe and hope that can contribute to this terminology and concepts entering people's mind to a greater degree.
Thanks, Per and Malin. I'm just mindful of the time. We have 2 minutes left. Dr. Meredith, to raise your hand.
Yeah, so I'm also looking at the time, but first let me thank Malin and Per. You both had very interesting presentations. And yeah, in the Philippines, we're interested in the competence center. We maybe offline we can discuss more about it. My question is really also for Per on Filani, because we've seen it in Cape Town. I'm just curious, you've mentioned you contextualize this when you transfer social innovation to other communities or country. Can you just maybe briefly describe how do you do that, and yeah, the process probably? Thank you.
The process of contextualization. So we initiated this project in 2018, and we did 2 things. Firstly, we conducted a small study where we made an assessment of different available indicators of child health in Sweden. And we identified areas that really stood out when it came to indicators such as vaccination rates, prevalence of childhood obesity, low breastfeeding rates, and so on. So that was an assessment to identify where it would be appropriate to implement such an innovation. And we also did not a study, but a review of different organizations working in Sweden with similar issues or on similar topics. And that was an assessment undertaken by the Church of Sweden. And so we identified a large number of different potential collaborating partners. And then we contacted those that were working in areas that where we felt that we could make a difference. Then we reduced the number of potential organizations to these two then that ended up implementing the Mentor Mother programs. So these were organizations that both had experience on working on similar topics and working with the relevant target groups, and that were also eager to try to implement this program. But then also, of course, the process of contextualizing the program has been ongoing. That is that after it has been implemented, it has had kind of a continual development. So one example of that is that the program implemented in Malmö has more and more focused on prioritizing the promotion of trust in health services, because that has really become clear during the implementation phase that is something that is incredibly important to work on in this area. That many people belonging to the target group have very low trust in authorities in general, and in extension also in health and welfare services. And so that has really emerged during the implementation phase, and that has been a learning process for that organization to shift their focus more towards that.
Thank you again, Dr. Meredith and Malin and Per. I think that concludes our SIHI talks for this evening. And any other parting words from Dr. Meredith or Maria?
No, just want to say thank you for this talk and for having us to co-host.
Thanks
Yeah,
again,
just wanted
everyone.
also to say congratulations to SIHI Sweden, and thank you for co-hosting the SIHI talks. Thank you, Art.
Please, if you'd like to receive a certificate of attendance, please answer the survey question. Link is provided in the chat box. Thank you.
Thank you.